Hi, everybody. I'm Malcolm Butler. I am the health officer for Chelan and Douglas counties. I'm also a family medicine physician at Columbia Valley Community Health, and I appreciate you taking the time to spend a few minutes with me today. We're going to look at some recent data, and then I'm going to talk a little bit about schools, and then we have some questions that we're going to answer. So here we go. Okay, so here are the graphics for this week. This is looking at our case counts. This was reported out as of yesterday. The important number, I think, is in the lower right in red there, 201 per 100,000 per 14 days. That is our current incidence, up from about 170 last week, so going in the wrong direction. Also, you can see in the lower right that number 28. We did report 3 additional deaths yesterday. And we have one more death which has been reported, and we're just finalizing our investigation of that. This then is looking at the incidence rate over time. You can see that we sort of bottomed out around October 1st, down around 110, and now we're back up above 200. And that green line is what the state of Washington feels is the high risk line. Anything above that is high risk, and the orange line is the low risk line. Anything below that is low risk. You can see we're well above that. This is looking at the Washington state data, statewide data. And you can see it's pretty clear now that we're rising up into our 3rd wave. You can also see those orange and green lines that are in there. And then I also put the little red dot so that you can see where Chelan and Douglas counties are on this map. Our numbers have more or less been tracking along with the state, but we've been quite a bit higher for the last several months. So our numbers are pretty high. This is a graph looking at how our hospitals are doing, pretty busy. And this is looking at all of the hospitals in what we call our catchment area. So these would be patients hospitalized at Confluence Central Washington Hospital, at Lake Chelan Community Hospital, Cascade Medical Center in Leavenworth, and Samaritan Hospital in Moses Lake, and I believe up at Mid-Valley in Omak. And what you can see is that back in July and August, the numbers got very high. But here on the right side of the graph through October and November, even though our numbers have been trending up, the hospitals have been fairly flat. And again, what that says to me is that the medically vulnerable and the elderly are isolating and insulating themselves from the infection. Put differently, the disease is being carried in people who tend to tolerate it fairly well and are not ending up in hospital. But the good news is we do right now have plenty of capacity in our acute care delivery system. This is an interesting graph that was put together for us this week. It's looking at ages over time. So on the far left is October 1st, on the far right is October 29th. And then the different colored bands there are different age groups. And you can see how the ages have changed over time. This adds up in total to 100%. And what I want you to see is that through the course of the month of October, 0 to 9-year-olds actually have been going down. 10 to 19-year-olds have gone up a little bit, but been roughly stable. But look at what's going on in 20 to 29-year-olds. Over the last week of October, they really took off. You can also see way up at the top, the most elderly folks, the numbers have been fairly small throughout the past month. So from our perspective, that's good news. This is something that's pretty exciting, I think. This is actually looking at ethnicity over time. On the left is Chelan County, on the right is Douglas County. On the far left is March all the way through to the end of October on the right of each graph. And the light blue are positive cases who described as Hispanic or Latino, and the dark blue are positive cases who describe themselves as non-Hispanic. And what you can see is that throughout most of the pandemic, about 80% of the disease has been carried in the Hispanic community. But here, since September, that number has gone down. And now so you can see it there going down. And now in October, you can see that we're down about 50%, which is dramatic and I think important, and huge kudos to the Hispanic community for whatever changes have been made. This orange bar is showing the 31% line. And remember, about 31% of our 2 counties self-describe as Hispanic. So even though we're down to 50%, that's still too high, at least based on the proportion of our community that describe themselves as Hispanic. So good news, things seem to be getting a little bit better for our Hispanic neighbors. This is a graph looking at age groups and Hispanic or non-Hispanic. So on the left, that series of bars over here are Hispanic or Latino. On the right, non-Hispanic. Blue is female, orange is male, and 0 to 19, 20 to 39, 40 to 59, 60 to 79, and above 80. So this is the total number of cases that we've had. And I just bring this to sort of point out, these are the folks who are becoming infected, and therefore these are also the folks who are spreading the infection. And these are men and women in their 20s and 30s. It's true in both Hispanic and non-Hispanic. And guys, guess what? It's us. So young men in the age of 20 to 40, we got to do a better job because we're causing some trouble. The last thing I want to talk about is this graph, and it is very busy, and I don't expect you to read through it carefully, but this is the flow sheet that the Chelan-Douglas Health District has passed out to all of the local schools and all of the local doctor's offices, and it talks about what we are supposed to do with kids who get sick. Now, every single year, kids get sick, and they get sick with a cold, or they get sick with the flu, and they go home for a few days, then they come back to class. Unfortunately, this year, they go home with a fever, chills, snotty nose, they might have COVID. And what that means is potentially we got to kick them out of school for 2 weeks, which is horrible and disastrous, and it's a huge problem, and we know it, and we are sorry, but there's no way around it. So what this flow sheet does is it really helps us understand if a child is sick, but it doesn't look like it's likely to be COVID, how we can get them back to school a little bit sooner. And again, I won't go into the details here, but what I want you to know is that this flow chart is available on the Chelan-Douglas Health District website. And so you should look for it. We will try and put a link to it on this video. So if you have questions as to what you're supposed to be thinking about when your child gets a bit of a runny nose and a bit of a cough, you can look for this, and the school should have the same thing, so should your doctor, your pediatrician, so that you're all on the same page. So that's the end of the slides, and now we'll move on to some questions. Okay, so here are the questions that we received this week, and I very much appreciate you all sending these in for me. The question is, a coworker tested positive, and I'm confused about what contact means. Could you please clarify for me and my coworkers what that means? So we know that COVID is usually transmitted by air, and sometimes it's passed by droplets that somebody coughs or sneezes that might land on you or land on your work site. And what we've discovered is that if you are around somebody who is infected with COVID, and if you're within 6 feet of them, turns out 6 feet is about as far as we can cough a droplet. If you're within 6 feet of them for more than 15 minutes, then the risk of you contracting COVID is quite high. And so we use that criteria within 6 feet for more than 15 minutes to define sort of the high-risk situation, and that's what we call a close contact. Now, if you just swing by a workmate and you're just chatting for a couple of minutes, that's a low-risk situation, especially if you're both masked. But if you've been within 6 feet of somebody for more than 15 minutes, and that's actually 15 minutes cumulative over 24 hours, then we are going to ask you, we're going to recommend that you quarantine yourself that you get tested. And if that test comes back positive, then you would isolate yourself. But even if it comes back negative, we're going to ask you to keep quarantining yourself for a total of 2 weeks. All right, next question. I see the COVID case numbers are going back up. At what number do I really have to start worrying and stay at home again? That is the right question. So yes, the numbers are going up, as I just pointed out. You know, actually, across the United States right now, the numbers are the highest they have ever been in the pandemic, the highest they have ever been. And as I pointed out in those graphs, we are well above the high level, the danger level already. In fact, we're twice as high, more than twice as high, that danger level. So right now is the time that you should be worried about it, that we all should be worried about it. Right now is the time when we should all be staying home. We should not be gathering in groups outside of what I describe as our pod, which is basically our household and maybe anybody else who's sort of part of that household. We have to remember that things like, you know, closing down businesses, closing down schools, putting in place stay-at-home orders or curfews, those are incredibly expensive and difficult for the community. And they're very late. That's the kind of stuff you're going to see very late. So don't wait to see restaurants being closed or schools being closed as an indication of when you should start staying home. Start staying home now and avoid gatherings now, because the numbers are super high. And if we're going to get them back down, we've all got to be really good right now about our COVID etiquette. All right, third question. How is the health district tracking COVID deaths? And aren't people actually dying of other causes? And so are the COVID numbers actually inflated? And I think that's an interesting question. So the way this works is that any resident of Chelan or Douglas County who dies and has COVID-19 listed on their death certificate is listed as a COVID death. And they might have died in Seattle or in Oregon, but if their residence is here, they're listed as a death for our 2 counties. Now, what I do as the health officer is I actually review every single one of those deaths to make sure that I agree that this is a COVID-related death. And I'll tell you, usually it's just very, very obvious. Even if somebody was quite elderly, they were doing fine, they were at home or they were in a nursing home, and then they get COVID, and then they get really sick, and then they go to the hospital, and then they die. And yes, it's true, they might have died within the next few months just of old age, but it's pretty clear that it was COVID that killed them when they actually died. We've also actually, we had a case of somebody who was positive with COVID and died in an automobile accident. And so that was not considered a COVID death. So just so you know, I review all of these and I'm very confident that the deaths we report are very clearly related to COVID. So that's the end of the questions for today. Again, I appreciate your time and your interest, and we'll do this again next week. Thank you.